Hello, everyone. Today's topic is ketamine in pain and palliative care. The trance-like state ketamine comprises pain relief, amnesia, and a sense of dissociation, like you are outside of your body. This is just a quote of a resemblance to the effects of ketamine on the human body. I always call it Doctor Strange, one of my real favorite movies. You get dissociated from the real life, okay? Sometimes this is very distressful, by the way. Maybe in children would be more acceptable, but in adults could be very distressing and actually one of the causes of stopping the infusions and medication. These are the objectives of our presentation. We'll start with the history. Ketamine was synthesized by Park Davis Laboratories by American scientist Calvin Stevens, who was researching for a new anesthetic to replace PCP, which was not suitable for the use in humans because of the severe hallucinogenic effects. And thus, this gets us to a very important point. A ketamine is a PCP derivative, guys. Okay? Ketamine was originally approved for use in humans by the US FDA in 1970. How about molecular structure? Ketamine is a racemic mixture, meaning it contains equal parts of two mirror image molecules, R-ketamine and S-ketamine. Sometimes we call it S-ketamine, all right, for simplicity. The S-ketamine is the S enantiomer of ketamine, which is considered more potent than the NMD receptor, believed to be responsible for its antidepressant effects. Ketamine is primarily used off-label for treatment for resistant depression and also a very important IV anesthetic. It can be administered intravenously, intramuscularly, or even intranasally. And its use in mental health treatment is not FDA approved. So we have ketamine, and now we have S-ketamine. The S-ketamine is mainly used for depression. That's it, nothing else. Ketamine has other uses. We use it in anesthesia, pain, and we're going to get into this later on in our presentation. NMD antagonists. These are the kind of drugs that block the NMDA. And this helps in prevention of opioid tolerance. It also helps with opioid addiction. It suppresses the wind-up phenomenon, central sensitization, opioid-induced hyperalgesia, and has an important role in neuropathic pain. It plays an integral role in synaptic plasticity, which is a neuronal mechanism believed to be the basis of memory function. This is basically the NMDA receptor. The S-ketamine, marketed under the brand name of Spravato, is an FDA-approved specifically for treatment-resistant depression, and it's administered as a nasal spray. It's often used in conjunction with oral antidepressants. S-ketamine is twice as potent as ketamine. Both ketamine and esketamine can cause side effects, but they might differ in nature and intensity. Common side effects of ketamine is basically dissociation, and thus in anesthesia, since I was an anesthesiologist in the past, we used to call it dissociative anesthesia because the patient is detached from reality. Nausea and increased blood pressure. All of these under when you're doing anesthesia are basically pretty easy to control. All right. The esketamine may cause sleepiness, a bad taste in the mouth, and similar dissociative effects. Ketamine or Ketalar, as we said, a PCP derivative. Most countries have a racemic mixture available for clinical use. Esketamine, the one used for depression only, is available in the US and Europe. It binds to the PCP receptor, which appears to be coupled with NMDA. Ketamine is extensively metabolized to a potent um, a metabolite called the norketamine, okay, by the 3A4 system. Ketamine can cause sympathetic stimulation, and this is the reason why we see on induction with ketamine increase in blood pressure and heart rates. It increases your salivary and tracheobronchial secretions, which is not a major issue unless you're having a problem with your secretions to begin with. And also emergence delirium, as we talked about, which is basically, as I said, it's could be very distressing. This dissociation from the reality could be distressing to adults, but it could be okay with kids. The drug mechanism of action is through NMD antagonism, as we talked about. Also, it inhibits the reuptake of norepinephrine, dopamine, and serotonin. Besides, it works also on non-NMDA glutamate receptors, such as the AMPA receptors. So, if you think about it, that's why it's very useful in pain and depression. This kind of give you an idea about the most important three chemicals in the brain: noradrenaline, serotonin, and dopamine. The serotonin is responsible for the depression, and noradrenaline is responsible for the alertness and energy and pain. Dopamine is more important for the reward and pleasure. So that's why the medication that increase the dopamine are helpful in like obesity and smoking cessation, for example. The drugs that increase serotonin helps with depression, helps with obsession, helps with compulsion, obsessive compulsive disorders. Uh, However, it can cause sexual side effects, and it also the norepinephrine, if it goes up pretty high, it helps with your pain. That's why you have to have, increasing the norepinephrine level in your brain to counteract the pain. Okay, serotonin doesn't do this job. Only norepinephrine. Okay, so route of administration, as we talked about, IV or IM, which has a very rapid onset. Other important information here that it's metabolized by the hepatic microsomal enzymes, as we said, the P450, to form the norketamine, which is basically hydroxylated and conjugated to glucuronide derivatives and excreted in the urine. Elimination half-life 2-3 hours, and it has a high hepatic clearance. Ketamine, again, metabolized by 3A4, but there are other enzymes like 2B6 and 2C9. In animal studies, norketamine was found to have an anti-nociceptive properties with a potency of 1/5 to 1/3 of the ketamine, but its analgesic effects in humans remain unclear. The elimination of norketamine and hydroxy norketamine, which is a byproduct of the CYP2A6 and 2B6. Glucuronidation is through the kidney and bile. Ketamine is contraindicated in acute liver failure, by the way. And this is a very, common question in the boards. These are basically the P450. As you see, the 3A4 is the most abundant enzyme in the body, followed by the 2D6. The effects of ketamine on the body system. Cardiovascular, as we said before, it stimulates the sympathetic flow, increasing the heart rate, blood pressure, and cardiac output. So in old days, we used to use ketamine to induce patients that are hypotensive, okay, like emergency cases, and patients are hypotensive. Because the heart rate goes up to 20% and it increased the workload on the heart. However, it's contraindicated in patients that are hypertensive or stroke patients. From a respiratory point of view, it's a bronchodilator and it's beneficial in asthmatics. As far as the CNS of the central nervous system, it increases the cerebral metabolic rate, cerebral blood flow, cerebral blood volume, and ICP. So, in a sense, it's relatively contraindicated in patients with raised ICP. And okay, so what are the contraindications here? As mentioned, individuals with poorly controlled cardiovascular disease. Secondly, hepatic dysfunction, or especially severe and advanced liver cirrhosis, for example. Patients with elevated intracranial pressure. All right, so this is basically just a view of the main contraindications. Poorly controlled cardiovascular disease, hepatic dysfunction, advanced hepatic dysfunction, and elevated ICP. By the way, as far as ketamine and porphyria, this is a debatable subject. So you can use it in patients with acute porphyria. However, not as a first choice. So what are the clinical formulations here? And, for ketamine. First, ketamine is used in anesthesia, conscious sedation, and general anesthesia, pain, acute and chronic, and others, mainly depression. So these are the three main indications: anesthesia, conscious, general, pain, acute and chronic, and others, mainly depression. There are other conditions, but don't worry about it at this point here. This is the real one, is resistant depression. So one of the formulation is IV ketamine. There is intranasal and there's topical. We're going to talk about the topical later on, but this is used for skin lesions that shows up in complex regional pain syndrome. All right. So basically, these are the settings in acute settings. Uh, and start with a bolus of zero point 0.3 up to 0.35 milligram per kilo, and infusions up to 1 milligram per kilo per hour. All right, as adjuncts to opioids for perioperative analgesia. Evidence is limited for the benefit of IV PCA, delivered ketamine, as a sole analgesic for acute periprocedural pain. However, you can use it as an adjunct. All right. Evidence supports the benefit of addition of ketamine to an opioid-based IV PCA, acute and perioperative pain management. So, as I said, ketamine for as a PCA for post-operative pain is not really substantiated with a lot of literature here. So, however, you can use it with an addition to the opioids in the PCA, and this is a welcomed, effect to reduce the tolerance, reduce the dependency, reduce the addiction, improve the pain quality, the analgesic quality of the opioids. All right. So how about palliative care? I've done several cases of ketamine in palliative care. And I'm going to tell you the best way to do it as far as I'm concerned. You can use it either intermittently, every 6 hours, IV intermittently. You start with a 5 milligram, you start with a 15 milligram every 6 hours, and then you see the results. And if you need higher dose, you go to 30, and you can go up to 60 per 6 hours, every 6 hours. So the maximum will be 240 milligram. Now, if you want to use an infusion, that's okay too. You can start with a 2.5 milligram per hour to a maximum of 10 milligram per hour. This will give you the same results. The maximum should not exceed 240 milligram per day in palliative setting. And it's a wonderful drug, but you have to monitor blood pressure, heart rate. You have to communicate with the patient. Some patients will report distress when they start to feel like, they're out of body. Could be very distressful to some patients. We had a guy like this, and he asked us to stop the infusion because of this weird feeling. But he had very good pain relief out of the ketamine. Ketamine infusions usually comes in bottles, 500 milligram per 10 ml. This is the commonest form that I've seen in most hospitals. Or in other words, 50 milligram per cc. And you prepare the infusion accordingly. The S-ketamine, as we mentioned, is the one that we use for, depression. And it's under the name of Spravato. And it's only present in Europe and United States. As you see here, Spravato. And it's twice as potent as the regular ketamine. And is given intranasally. How about the topical ketamine? This is not something that a lot of people talk about, but I've used it. It's very nice, especially in when you have painful lesions. So you can use it in combination. Local anesthetics and gabapentin, for example. This is should be done through a compounding pharmacy. All right, this is not something that you do yourself. There are companies in the United States, maybe in Europe, they prepare this gel for you, and it's a basically ketamine plus different things like local anesthetics. Sometimes muscle relaxant, sometimes gabapentin, and so forth. All right, and usually it's done to the patient that have topical lesions, not any case. Okay, it's pretty safe unless you kind of put it all over your body. Of course, you will get intoxicated. But if it's just a lesion in your limbs, you can put uh, the cream. It's a wonderful. See, this is just one form. And as I told you, it's for example, this is compounded by a company here. The name is here. I'm not gonna mention the name. I don't care. But I just wanted to tell you that this is has to be done through a compounding pharmacy. These are some lesions that we see in CRPS. And I had a case like this. It's really very painful. And, it's good to have something that you can, help with a topical instead of giving everything systemically. Okay, so let's review some of the uses of ketamine. In acute pain, patients go undergoing painful surgery. Opioid dependent or opioid tolerant patients undergoing surgery. Ketamine are used also for opioid dependent or opioid tolerant patients with acute or chronic sickle cell pain. Also for patients with sleep apnea. This might give ketamine an advantage to limit the opioids. Okay, how about chronic pain? It's used in chronic intractable neuropathic pain. Can be used in intractable migraine headaches and also in intractable pain and in palliative care setting. Non-pain uses, as I mentioned, could be the most important is depression, resistant and intractable depression, other neurologic applications, basically under research, like neuroprotection, seizures, ketamine and alcohol and substance use disorders. From this slide, I want you to just remember intractable and resistant depression. That's all you need to recall as far as the non-pain uses of ketamine. Okay, this is a nice picture of the brain cells, the microglial cells, astrocytes, ependymal cells, and so forth. The microglial cells are very important in the central nervous system. These are the macrophages of the brain, and they actually responsible for taking back all the glutamate in your central nervous system. Now, if these microglial cells got stimulated by prolonged use of opioids, for example, they will release a surge of glutamine in the CNS, and this can cause excitability all over your body. It's a state, we call it opioid-induced hyperalgesia. Okay, so here comes the role of ketamine because glutamate works through the NMD receptors. If you block it, then you can stop this phenomenon. Okay, so I'll just give you one example. Okay, the overactivated microglial cells here can cause a lot of things, guys, we didn't know about in old days, like chronic fatigue, depression, intellectual decline. And that's why there's an NMD antagonist drug called memantine. We use it in advanced dementia, right? Centralized pain. So we use ketamine in pain. All right. So I just wanted to give you an idea of the uses of NMD antagonists in general. Also in patients that have drug-seeking behavior. So we use methadone, for example, in addicts, in opioid addicts. Okay. And so we can help them out to come out of the opioids and be prepared for it. You know? So these kind of things, you have to open your mind about this NMD intake because it works into so many aspects in pain medicine and palliative care. All right. Ketamine sometimes is used recreationally with high potential of abuse. And I want to say ketamine is a PCP derivative. So imagine, I mean, people still use it for, recreation. The range of sensation that can happen starts with pleasantly floating to sensory detachment. They call it the KO. In high doses, it can impair the motor function, high blood pressure, and potentially fatal respiratory problems. One of the biggest actors in the United States, Matthew Perry, died from ketamine abuse. Okay, so it's a serious drug. All right, we don't like to use it as outpatient. Okay, depression, okay, for like the Spravato and so forth. But generally speaking, to give ketamine to someone to take home is not something as a pain physician we're really very open to. I want to say in my career, I've done it only once. Okay, but the patient was a reliable patient. Of course, he was a very difficult case. Ketamine comes in the for addicts. It comes under different names like Ketalar, new ecstasy. Okay, actually, Ketalar is the IV formulation. New ecstasy, super key, KitKat. So be aware about these different names. Okay, it can come like a solution. It can come as a powder. All right, we're going to ask some questions here. What are the most common side effects seen with the use of ketamine for procedural sedation and analgesia? The answer is emergence phenomena, laryngospasm, and tachycardia. So be careful about this because despite ketamine doesn't cause, respiratory depression except in, very large doses, but it can cause laryngospasm. And you need to be able to handle this. And this can lead to major catastrophes. Of course, the emergence phenomena that we talked about, the dissociative effects of ketamine, Doctor Strange, you feel you're out of body. Which opioid would show up as PCP in urine drug test? It is ketamine. As you know, we just mentioned it. It's a derivative of PCP. All of the following are true regarding ketamine, except it is recommended for, no, it's not recommended for neuroanesthesia. And it's not safe to put it intrathecally with the rest of the intrathecal drugs. So be careful about it. All right. Um, I mean, we don't have data yet. All right. So key learning points. Ketamine has a role in medical practice where it is used to produce dissociative anesthesia, which means that the patient is not necessarily made unconscious. However, they are in state of dissociation, catatonia, and catalepsy. Most countries have racemic mixture available for clinical use. S-ketamine is available in US and Europe. It binds to PCP receptor, and it appears that it's coupled with NMD antagonism. Ketamine can cause sympathetic system stimulation, increase salivary and tracheobronchial secretions, and emergence delirium. Ketamine plays an important role in anesthesia, pain management, palliative care, and mental disorders. Thank you so much.